in addition to diagnosing Ms. Heard with these two personality disorders, did you form another opinion about Ms. Heard's mental status?
Yes, so go ahead.
If the answer to that is yes, I'm going to now ask you,
okay,
what
yes,
was that?
I did.
Okay, what is it?
So in addition to looking for Ms. Heard's general mental status, any psychological issues that were present, I very specifically was assessing to determine whether post-traumatic stress disorder was present, and it was not.
How do you know that?
So first of all, from multiple information sources, right? So I was integrating the interview, my review of the data, the case records, other people's testimony, her treatment records. And then I also conducted, in addition to the MMPI-2 and looking at that data, I also conducted the clinician-administered PTSD scale, the CAPS-5, which is the gold standard PTSD assessment developed by the National Center for PTSD, shown to be valid, accurate for use not just with service members, but also with civilians, men, women, all genders, and also all ethnicities, and then also specifically for use in a courtroom setting.
How do you conduct the CAPS-5?
So the CAPS-5 is a standard interview. What that means is that it's an interview with very clear questions that are scripted, and you ask those same questions every time you test a person. So because you're doing that, you're actually taking something that would typically be kind of subjective, an interview with somebody, and you're making it more objective. When you ask those same questions in the same way every time somebody's assessed with this, now you can apply a scoring protocol and actually score their responses.
As a result of applying those protocols, what did you conclude?
Ms. Heard did not have PTSD, and there were also pretty significant indications that she was grossly exaggerating symptoms of PTSD when asked about them.
How did you make that latter conclusion?
So one of the strengths of this test, as I mentioned, the important thing about any test used when you're doing an evaluation in forensics is to make sure that the person is responding accurately. And this test does that by not just asking people whether they have a symptom, but asking follow-up questions that draw out very detailed accounts of every single symptom of PTSD. And when you're really familiar with this disorder, which you need to be to administer this test, there are nuances in the way a person will describe their symptoms that have been shown repeatedly to indicate exaggeration or faking. There are also indications when somebody is clearly giving you a genuine response.
Okay. What, if any, symptoms of PTSD did you observe in Ms. Heard?
So there are 20 kind of core symptoms that somebody can manifest with PTSD. You don't have to have all of them. Ms. Heard initially said that she had, in the first question, you say, do you ever have this, before you get to the more nuanced follow-up questions. When I asked that first question on each item, she initially said, yes, I have that, to 19 of the 20 symptoms. That's not typical even of somebody with the most disabling form of PTSD. When we eventually sort of dialed it down, she had 3 remaining symptoms. And having symptoms of any disorder is common for all of us. Some of us struggle with sleep. Some of us get anxious. It could be several different disorders. It could just be that you have this struggle in your life. But she had 3 specific symptoms that I scored as present. Off the top of my head, I might miss one, but one was sleep disturbance. So she reported that she has frequent nightmares. Another one was that she said that she tends to have a startle response. So if she gets startled or surprised, she tends to stay in sort of a hyper startle mode for quite a while. And that's consistent with a couple of things. It can be consistent with PTSD if other criteria are met. It's also consistent with childhood complex trauma, which is something that can occur when your brain is forming. If you constantly feel unsafe if your parents are abusive, or if they're not present, if you're neglected, you can develop certain physiological responses that can stay for a long time in your life. So I noted that seemed like a very genuine, accurate account where she stays in the state of kind of hyper arousal, has a hard time calming down if she gets surprised.
You mentioned nightmares as well.
Yes.
Did she